I'm Dr. Vijay Nagdev, dermatologist, dermatocosmetologist, and hair transplant surgeon from Pune. I have three clinics in Pune. Name of the clinic is The Skin Doctor. I have one clinic in Pimpri, Ajmera, second in Pimples, Saudagar, and third is Hinjawadi. My special interest in dermatology is to bring up new trends in dermatology, new technology, and new treatment options in dermatology. Today, I'll be discussing a very common skin problem, and that is acne and acne in summer care. I'll be covering what is acne, types of acne, causes of acne, acne in summers, and what are the treatment options available for acne. So, let's start with what is acne. Acne in layman language is also called as pimples. Pimples are very common at the age of 13 to 25, that is teenage. Now, why pimples are common at this age? Because this is the age of development. This is the age of hormonal changes. So, in hormonal changes, which hormone is mainly responsible for acne? So, that is androgens or testosterone. Testosterone is mainly a male hormone, but in less quantity, it is also present in females. So, that's what pimples are common in both males and females. So, how does this hormone act? What is the mechanism behind acne? So, when this hormone, androgen or testosterone, secreted in the blood, it acts on end organs like sweat gland and sebaceous gland. When they act on sebaceous gland starts secreting oil. When oil secreted from the gland, it passes through a duct and it finally released on the surface of the skin. Because of hormonal changes, the duct from this oil release gets blocked. When that pore is blocked, oil cannot come out. Oil gets accumulated inside the gland. After some time, pressure inside the gland increases and that gland bursts out open on the surface. Surrounding bacteria in the gland starts acting, which leads to the formation of acne. So this is how acne forms. Now, what are the types of acne? There are mainly two types of acne. One is non-inflammatory acne, one is inflammatory acne. Non-inflammatory acne means where there is no inflammation, there is no redness, no swelling, no pain. And in inflammatory type, inflammation is present, redness is present, swelling is there, sometimes pus is there. So non-inflammatory acne are, you must have seen blackheads, whiteheads, and in inflammatory types, papules means red colored papules or pimples. Second, pustule, pimple with pus. Third is nodule, large pimples and hard pimples. And last is cyst, soft pimples. These are the type of pimples. Now, next is there is one more type of pimples which is also called as pleomorphism. Pleomorphism when a single person has all the types of pimples, non-inflammatory and inflammatory type of pimples like whiteheads, blackheads, papule, pustule, nodule, everything in a single patient. That condition is called as pleomorphism. Next, one more classification of pimples is there as per age group. So that is teen age group pimples and adult acne. Teen age group acne is seen in teenagers. It starts at the age of 13 to 14 and it lasts up to age of 25. But nowadays, because of poor lifestyle, it can last for long. Adult acne starts in adult life, means after 25 years of age, it starts and again it lasts for very long. Now, how adult acne differs from teenage acne? Adult group acne seen in adult life, that is one. Second, adult acne mainly seen in lower part of the face, that is at the chin area. Adult acne is not very severe acne. Pimples are seen scattered and only few pimples are seen. Pimples are inflammatory in condition. You don't see comedons in adult acne. So this is how we differentiate adult acne and teenage acne. Other types of pimples are drug induced acne. So acne because of certain drugs. Very common drugs are steroids. If you are using any steroids or some other medicines because of some other conditions, like for example in tuberculosis, you take anti-tubercular drug, that can lead to acne. If you are taking steroid, for example in arthritis, that can end up into acne. If you are using any fairness creams which contain steroid, that again cause drug induced acne. Next type of pimples are vaccine induced acne, again very common in females. After 2 to 3 days of vaccine, you see pimples in treated area where you have done the vaccine. Next type of pimples or acne is dandruff induced acne. If you are suffering from dandruff, you should use anti-dandruff shampoos, because when that dandruff comes in contact with your skin, the fungal particles, fungal infection in the dandruff reacts on your skin and aggravates the pimples. That's why you should use anti-dandruff shampoos for dandruff. Next type of pimples or acne is frictional acne. Frictional acne is friction between skin or something. For example, those who wear helmet for long time, they get pimples in neck area because of friction between helmet and the skin. In females, pimples on bra strap. Next is mainly on the shoulders, those who carry sack, college sack or school sack. So that type of acne is called as frictional acne. Next acne is acne cosmetica. Acne because of cosmetics is called as acne cosmetica. If you have acne, try to avoid cosmetics or heavy makeups. If you want to use any makeup, use water containing makeup that can be easily washed off. Don't forget to wash your makeup before you sleep. Don't keep overnight makeups. Next type, which is very common is and which is very difficult to treat acne, is acne because of PCOD. PCOD is polycystic ovary disease. It's a disease very common in uh, females. People with PCOD come to us for pimples treatment. But in PCOD, only pimple treatment is not effective. Along with the pimple treatment, you have to take treatment for PCOD. In PCOD, there are few signs where you can diagnose you have PCOD or not. Those signs are thinning of hair, pimples on your face or body, facial growth in females, darkening of neck, underarms, and sometimes genital folds. These are the signs of PCOD. So, if you have PCOD, you should get tested for hormonal changes. You should consult the endocrinologist. Along with the treatment of PCOD, we can treat your pimples. Main treatment for PCOD is not only the medicines, it's lifestyle modification. Lifestyle modification is the rule in PCOD treatment. Means you have to take care of your diet. You have to start exercise, not normal exercise, heavy exercise. Sound sleep of 7 to 8 hours. If you are smoker or alcoholic, try to avoid smoking and alcohol.